Thanks for joining us. My name is Reba Rice. I'm the CEO of North Lakes Community Clinic. I'm here to host what will be a series of conversations around the current status of COVID-19, the treatment options available in Northern Wisconsin, the upcoming COVID-19 vaccine, and some of the questions around its safety. There's a lot of information nationally about what's happening right now, and we recognize that information can be confusing and overwhelming. So we're hoping that with a couple of conversations from folks on the front line, we can get some clarity around what's really going on right here in Northern Wisconsin right now. Today's focus is what we know about the COVID-19 vaccine and some basic information about vaccines in general. I've invited some individuals who are well informed about the current status of the COVID-19 and how vaccines will work to help us with combating the virus, and they'll give us an update. Let's start with introductions. Let's start with you, Dr. Dreyer.
I'm Dr. Deb Dreyer. I'm a family medicine physician with North Lakes Community Clinic. I work out of our clinics both in Iron River and Ashland. I also am the Chief Medical Officer for North Lakes.
And Dr. White?
I'm Dr. John White. I'm the Director of Emergency Medical Services at Memorial Medical Center in Ashland, Wisconsin.
And Dr. Reitz?
I'm Ann Reitz, family medicine. I am a family medicine doctor at the Red Cliff Community Health Center and the medical director there.
Great. I'm going to start out with an update on when COVID-19 vaccines may be available in Northern Wisconsin. And we've got two different answers here. So I'm going to start with Dr. Dreyer and then move to Dr. Reitz. So Dr. Dreyer, would you provide us with a quick update on when COVID vaccines may be available in Wisconsin and then how it will be distributed?
Sure. As many of you know, based on all the media coverage, there are two different kinds of vaccines that have been approved for emergency use authorization. One is the Pfizer vaccine. The other is the Moderna vaccine. Both of them are kind of similar in how they're made up. Currently, the distribution is happening initially on the federal government level. The federal government is dispensing vaccine to the individual states. The states are sending them out to their vaccinators throughout the states. Wisconsin has chosen to do a hub and spoke type model. So the state of Wisconsin has 8 hubs within the state. And so they're distributing vaccine to those hubs, and those hubs will distribute vaccine to kind of the smokes or the communities around them to vaccinate their high-risk populations, including their healthcare workers and residents of long-term care facilities and employees of those same long-term care facilities. The state is also taking into account what's called the Social Vulnerability Index, which looks at some of those risk factors of communities and the population on whether that population will be more at high risk, and trying to preferentially get a little bit more vaccine to those folks a little bit earlier. And so far in Wisconsin, we have received doses of the Pfizer vaccine, and those have been started to get delivered and administered to healthcare personnel. The Moderna vaccine was just approved at the end of last week, and that will be out. They're anticipating shipping is already happening this week, and so hopefully by the end of this week, that vaccine will start to get utilized in our communities. Northern Wisconsin tends to be a little bit more rural. I anticipate that it's going to take a little bit longer for us to get the vaccine up into our area, but really, I'm expecting to see both the skilled nursing facilities and healthcare workers in our areas get vaccinated, hopefully with the first doses in the next couple of weeks.
Great, thank you. And I think Dr. Wright's tribal clinics had another avenue that they could explore. Can you tell us a little bit about your experience with COVID vaccine?
We had the option to go through the Indian Health Service distribution system for the vaccine. And so both the Pfizer and Moderna are coming to us through the Indian Health Service. So we've actually been able to start vaccinating last week. So.
Great. So there's a lot of talk around whether vaccines in general are safe and effective. Dr. White, can you talk about why someone would want to consider getting vaccinated?
Well, as a society, vaccines have been around for decades. This particular set of vaccines is a little bit different in terms of how it's made and how it works. But I think it's been well established that vaccinating against a variety of infectious disease has been wildly successful for our society and most of the world. Clearly, as well, as much as we have tried to encourage preventative measures, they haven't been as effective as we would like. And so the next step is actually vaccinating in hopes of reducing the numbers of people that are infected over time, and then also hopefully inducing so-called herd immunity, where the more than 3/4 or 90% of the population is immune either through infection and vaccination, and that results in the viral transmission being cut off, and then hopefully we can be basically free of the infection as a society.
Great. And moving to you, Dr. Reitz, would you say vaccines in general are safe for people?
Yeah, vaccines are exceedingly safe. They're the safest form of medical treatment that we have to offer patients. And the amount of study, the degree to which vaccines are studied and proven to be safe, essentially, and the number of lives that are saved by using vaccines far exceed any of the benefits to any prescription medications that we order for people. The vaccines save way more lives than any other form of medicine that we prescribe, and again, they've been exhaustively studied. And in this case, I would like to put a plug in for updating immunizations for influenza and pneumococcal vaccine, since those are the most common reason, or prior to COVID, they were the most common reason for admissions to hospitals, influenza or pneumococcal pneumonia, that if we can update everybody's immunizations for flu and pneumococcal pneumonia, that could help this winter. So I would encourage people to pursue that with their providers as soon as possible. And to realize that vaccines, that this particular set of vaccines, the first two that have come out are a new type of vaccine, but though the mRNA vaccines they began that genetic research back with MERS and SARS, which 2016 or so. So they've actually been working on this particular technique for vaccine development for many years. And it was just as soon as this virus came up that they could take advantage of this new technique. And so it isn't as if this was invented overnight. And certainly the numbers of people who have received the vaccine and suffered no significant health consequences imply or clear, it's fairly clear that we are safer getting this vaccine than getting in our car and driving to work. So I think people have to realize the degree of risk is extremely minimal with taking these vaccines, and the benefit far outweighs that risk.
Great, thank you. And Dr. White, is there any reason for folks to delay or to not get vaccinated?
Well, at this point, the two vaccines that are available, depending on which vaccine, are cleared for age 16 or 18 and up. So at this point, it's not yet approved for age groups less than that. The only other set of people that really would not want to get the vaccine would be those that had a severe reaction to the first vaccine, which is, again, an extremely rare occurrence, at least from what we have established thus far. It's, I think, for people that have had a recent infection, given that we are on a limited supply, it's reasonable to delay it up to 90 days after that infection, just because of the chance of a reinfection is exceedingly low. Although I would still say if you have access to it and you're in a high-risk group and have had an infection still should get it no matter what. But those that are younger that would have had a recent infection, then it is reasonable to delay it such that others in the higher risk groups can get it. But otherwise, there really is not any other contraindication to folks getting the vaccines.
Great. I understand that the COVID-19 vaccine is brand new, and there are still a lot of questions about it. You guys have given some really good feedback. But what do we know about the COVID-19 vaccine and how effective it is? What are the things that we can tell from the studies that have been done, and what are some things that you would tell our community members about what you believe about its efficacy? Dr. Dreyer, can we start with you?
I think the most important thing to recognize is this vaccine works. I mean, the data is pretty solid behind it. It's 94 to 95% effective at preventing symptomatic disease. And more importantly, that means symptomatic disease that could progress onto serious illness, leading to hospitalization or even death. So if we can prevent this disease from happening and from people from getting symptoms, we can save lives. I think the other important thing to recognize about this vaccine is what it's been studied for is preventing patients who have symptoms and who are positive for COVID. We don't necessarily know how contagious people will be after the vaccine, like if they could still get a virus but not be symptomatic from it and spread the virus. And so the current safety recommendations, even after receiving the vaccine, are still in place. So we still recommend the wearing a mask out in public places, social distancing, lots of hand hygiene. All of those things continue to be super important to continue to do for even 5-6 months after receiving the vaccine, because it is going to take a time to get this out to our communities and to get as many people as we can vaccinated. So we need to continue our safety measures.
Great. Dr. Reitz, anything to add?
No, thanks. That was very well said, Dr. Dreyer.
Dr. White?
Yeah, I would just like to echo the last part of what Dr. Dreyer said, is that despite either having had the infection or getting the vaccine, we still need to practice the mask wearing, the hygiene, the social distancing. I have had the infection within the last 6 weeks, but I still always wear a mask because I just don't know what I'm transmitting to others. And that's really the key behind all of this, is that it's not only what you're doing for yourself, it's what you're doing for others in preventing the spread.
Right. Well, and access to the vaccine is a really important issue. So, Dr. Dreyer, perhaps you can talk about whether or not the vaccine will be affordable for people.
Certainly. The great thing about this vaccine is what we're being told by the federal government currently is the vaccine is going to be free. So the vaccine itself is free. The one thing that patients may or should become aware of to expect is that they may have a small administration fee with each of the vaccines. So currently both the Moderna and the Pfizer vaccines are a series of 2. So you get one, and then either 3 or 4 weeks later, you get your second booster dose. So you may see a small fee associated with them for an administration, but the vaccine itself is being covered by the federal government.
Great. So lastly, for all 3 of you, do you have any sense about how this vaccine may impact COVID-19 in 2021 based on past vaccines? And so will this vaccine allow any sort of return to normalcy, or is this our new normal? You've talked about how we need to continue our safety practices, but is there a time in 2021 when we are looking at a post-COVID world? Dr. White, let's start with you.
Well, that is obviously the hope, and we're not entirely sure where we reach that herd immunity level. There's all kinds of projections of the percent of people that need to be immunized plus have the disease to reach herd immunity. But I think we can look forward to maybe the midsummer, late summer of potential return to normal. Again, it depends on vaccine distribution and how well people continue to work on prevention. But I think there is light at the end of the tunnel in terms of some normalcy. of our activities outside work.
Great. Dr. Ann, how about you?
Well, I would just say to reinforce that message is that I think we honestly, we don't know the answer, but the more people who get vaccinated and the sooner that eventual return to normal will be. It's going to be very gradual because it's going to take time to get people vaccinated and to figure out how to gradually, for one thing, making more testing available. I think we're still limited on testing. Testing could help in returning life to normal. Is to have some protocols that might help us with school opening, for instance, with using airplanes for travel again, for return to more, in terms of job, in terms of large scale factories or places where many people work. The more testing, the better, to also be able to return to some semblance of normal life. And then I do think people need to realize too that this vaccination is going to be it is not a requirement. An employer can't require you at this time, but in the future, it's probably going to be important for people to be able to say, yes, I have been vaccinated. And people will be asking for that proof. So just begin to realize that that's going to be part of this return to normal life. There's going to be some expectation there for people to document that they participated.
Great. Thank you all. All right. So we'll continue tomorrow with further discussion around treatment for COVID-19.